All right, all right. Here we are. I'm Scott Willey. This is another edition of the Elevate Revenue Cycle Insight. Today we have Ryan Riddle with Christus Health, and we're so pleased to have you. One of my favorite people in the business, one of the most fun people, and one of the best leaders in the industry. And I've been begging you to get on here for a long time, and so thank you for making time.
Absolutely. You're welcome. You're one of our favorites as well, Scott. So.
All right. Gosh, I love hearing that. Look, we're just going to do this very casually. A couple of questions, a few questions. If something pops into your head that you want to go down a different route, then absolutely bring it up. We'll talk to you first about your background. Tell us a little bit about your background, your education, where you came from, and how you got here.
Yeah. So hello, I'm Ryan Riddle. I am VP of Patient Access here for Christus Health. I've been with Christus for 10 years, 10 years this year actually. But my background is I'm originally from Spring, Texas. Went to Spring High, not Klein, and then I went to school at Trinity University, did my undergrad and graduate there, got my MHA for health administration. And then from there, I ended up having to do a residency in healthcare administration, and that took me to Shreveport, Louisiana. And so I was part of LSU at the time, LSU Health Sciences Center, which at the time was a state facility. And I was there for 8 years. And at the end of the day, I'm a Texas girl, so I needed to come back to Texas. So I ended up with Christus, and I've been with Christus ever since. And the interesting thing for me, the blessed thing about me is that I've always been in this role. This was like honestly the second job I've ever had, and they wanted me. I needed a job once I got through my residency. And so they said, "Do you want to be the director of patient access?" And I said, sure, because again, I needed a job. And I've been there ever since. So I really, truly have watched this department grow and build up that team, starting at LSU first, because they didn't have anybody. There was no one in that role. And kind of got into it with my team and kind of figured it out as I go. And again, I've been here ever since.
Right. So you're one of the few, okay, I ask this question every time, and most people have a weird, well, I knew a lady who got me in as a registrar and then whatever. You know what I mean? I met a guy at a tailgate party. That's my thing, right? And got into the business that way. But you actually took, a route that is a normal. What do you say?
I'd say it's normal, but again, for me, I've been in school, always was staying in school until I figured out what job I wanted to land or what job was going to take me at that time, because it was 2008. So we were in the middle of that other recession. So, and I was lucky, truly lucky, because out of my 25, so Trinity is a very small university.
Yeah, sure. Great school, by the way.
Yes, it is. And so we had a very small class. There was only 25 of us. And the 25 of us, about 4 of us actually stayed on or had a job at the end of graduation for that December. And I was one of those 4. And again, that they were just able to thankfully keep me on. And the role came up. And again, I needed a job. So I
think they say good things happen to good people.
Yes.
Right? That's what happened with you. Hey, tell me about your role currently.
Yeah. So right now I am patient access, VP for patient access. I started regional director, then moved up to another VP for Northeast Texas, and now I'm over everything patient access for Christus. So right now it's a new role for me. I've been here a little over a year and a half officially into this role. And what's kind of entailing that was we're moving to Epic. We actually finished our last biggest go live a couple of months ago, and that's moving all the ministries into Epic. And so that comes with standardization and figuring out what that needs to look like for the system wide. And so it kind of naturally fit that as I was leading the team down their Epic path, that I ended up leading the team for all things patient access. So that's the role I'm in now. We're in a bunch of transition, trying to figure out what does this look like from an org structure standpoint. But the cool thing or the good thing I see is that because I came from a regional director, I knew the players. The teams know me, so they kind of know what I like to look into and like what's like to get us into. So that's been kind of the benefit is it's not a brand new person that came off the street into this role. There is someone they're familiar with, they're comfortable with. And the other cool thing is I'm getting to learn them. When before we were very siloed into our ministry, but my biggest goal right now is I tell them all the time, we're not going to struggle alone. We're going to do this together. So, having everyone trying to come to the same standardization, the same ideas, it's been a challenge, but they've done really well. And I think they've done well just because they have a platform for someone who's able to listen for them and see what can we do and go from there.
Well, it's been nice for us as well as a vendor partner going through those transitions and conversions and whatever, having steady leadership like yourself. And so we appreciate everything that you do for us, helping get through this as well, because it's no easy task. It's no small task. And so you've been great, and your team has been great. So they've got a great leader. What do you love about your job the most? Other than your vendor partners. I know. I'm kidding.
They're always the best. But I think my favorite part about the job is when I get, which I don't do it often, but my favorite part is when I get to go out, when I get to go to the ministries and I actually get to be in the space. I think that's where I'm at my best. That's where I get to see what's really going on in practice versus what I say is happening in this office. So that's my favorite part of the job. And again, unfortunately, I don't get to do it as often as I would like. I'd like to change that, but that's my favorite part is again seeing the regular PARs, the people in the ER, the people that are at main admitting, and just hearing them and just seeing them actually in action.
Now, when you get through with the conversions, will you be out more?
I hope so. That's what I'm hoping for and intending for. That way we can actually see what's going on. I'm building my leadership team up underneath me. And so that's one of our priorities is to get them, if it's not me, it's one of them to go out there to be able to see the team and see what they're doing.
Brag on your employer a little bit.
Christus Health I wouldn't be anywhere else. They are, what I love about being at Christus is it is different here. And I felt it when I first had my first interview back in San Antonio. It is truly, truly different here. We truly do put the patient first, and we mean that. And we mean that not only from rev cycle, but from clinical, even to the person, watching the elevators. Like it's truly a thing, and you feel it when you come through the halls, even from a facility at the hospital, or even here at the Irving office. It's our patients come first, and we're going to make that happen. And I stress that to my teams as well. And it's when you have that single vision, that single mission, it makes the job a lot, I'm going to say easier, but you know what your focus is.
Do they take the patient and the employee experience very seriously, and they go out of their way? That's I see that, and our team sees that, and that rubs off on our team as well. They're awfully proud to represent your organization. We've got people in every one of your hospitals, people in back offices all over, and they are, and it resonates. Their people are awfully proud to work with your organization.
It's been great. Chris has been a good place to be.
New fiscal year, okay. Can you talk about a couple of goals that you guys have?
So I was hoping we'll be done with conversion, but we've got another facility coming on board. This will be very different for us because they are on a totally different system. They're on a Cerner system. So we'll be going out to Alamogordo, New Mexico, and bringing them on task for us onto Epic. And that's going to be a new learning curve for us as well. The other big goal that we're looking into, we talked about engagement with not only with our team. So not only between internally, but looking at engagement from the rev cycle to even crossing over into that clinical side. And then the other probably big thing that I am looking forward to do is we do a lot of things manually. We still do. And what I kind of see that is, like I told my team a couple of days ago, is we've been in implementation mode for the last 3 to 4 years. And so we really haven't had a chance to enhance or optimize what we currently have. So we're still kind of using the processes that we had a few years ago. So what I'm looking forward to do is try to figure out and determine, what are some efficiencies we can gain with technology, and how do we leverage that, and how do we repurpose people? How do we put people into the places that are more complex and putting our resources there versus the things that are kind of routine? Where can I use technology to leverage for that? So that's probably the other big enhancement optimization is on the list for this fiscal year.
Okay, good. And this is one that we ask everyone, and some people. Well, let me just ask the question: is there anything keeping you up at night? What keeps you up?
Well, a lot of things keep me up at night, Scott, but when Cowboys, what are we doing this year? But
that's going to keep you up all season, I'm afraid. Big Cowboy fan, aren't you?
Yes, I am. But I think what keeps me up at night right now is just managing all of the things, managing all of the ministries and the things that they do that we're not aware of. We always find something once you flip over that rock and there's a new thing sitting there. So I think that's what I'm the most worried about. But then also, as I guess I'm building this leadership team, making sure they feel supported, and how can I make sure that I'm giving them what they need in that same space. So that's probably my biggest worry is how do I support them? And then again, what's the unknown that's out there that I'm not aware of?
Right. Yeah, the unknown. That'll keep us all up. Sure. Well, and with the big beautiful bill, right? That's one that who knows? It's down the road a bit, but I guess we have to kind of prepare for the unknown.
We have to prepare for it, and we have to see what's going to happen. We'll see what happens. My theory right now is we'll see what happens in midterms, and we'll go there and we'll pivot from there.
That's right. That's all we can do. How do you set your team up for success? What's the key?
For me to get them where they need to go is knowing what their strengths actually are and how to capitalize on that.
That's good.
Not everyone does the same thing. That's a true statement. And you've got to know, if this leader is better at, I have one person, they are my wordsmith. They can make anything sound wonderful and just have all the themes and the words and get straight to the point about it too. And that's a strength that they have. And, I let them have that space. Or I have a person that's a very much analytical, more of a thinker, logical, wants the things to go in a process. I put them into process improvement things. So just knowing their strengths and knowing how to put them there. One, so that they have the confidence in what they're doing because they're comfortable with it. But then two, how to explore that elsewhere. When I'm hiring for a leadership role, I always tell them and myself, you got to find someone not like you, but compliments you. So having that team. Oh, okay.
Well, that's my next question.
Yeah.
So promote from within, or recruit new talent.
I prefer to promote from within. That's my preference. That makes the most sense to me. However, you have to know when to pivot. Like you have to know when, we just truly need some outside thoughts. We need an outside perspective here. And knowing that, they've been doing it this way since my favorite phrase, 1902, and we need something else. So, prefer to promote from within, particularly if I think they have all the strengths that are needed. And knowing, for me, the role that I'm in, I tell them, I can't train people. I can't train you on patient access. I can train you to help you to be a leader, but I can't train you on how to register. I need you to be able to have that background and you to be able to do those things. So again, knowing what their strengths are, and again, like I said, they have to complement the leader, not necessarily like them, but complement them. And that's how you kind of build up your team from there.
Sure. Great answer. You have any role models?
I try, Scott.
Yeah, you're doing great.
In business.
Who are your role models in business?
So role models in life, of course, I think, of course, but my parents, my mom and my dad, my first personal in life, they got me here, and they're the most supportive parents a person could ask for, and we just keep on trucking. But in business, I do have one person I have many folks, but one person that stands out is my first boss at LSU, Betty Johnson. Betty Johnson, she was the COO of LSU Health Sciences Center, and she just the one that took the chance on me. But what I liked about her is she knew how to bring the right people to the table. So whatever the problem was, she knew how to get the right folks. Let it be from the registrar, because it was a registration issue, and getting, the registrar, the clinic nurse, the VP for that clinic, just getting everyone at the table so everyone's perspective can be heard, and knowing how to manage that, because that's also the key to that as well, when you put everybody at the table. But I like the approach of putting everybody at the table. That way, again, they're able to be heard and try to figure out what is the solution that we're all trying to get to. And so she was one of those ones. Every Friday afternoon, I'd head over to her office and be like, all right, this is what's going on this week, and how do we work through it? And she was just always a very, very good mentor for me.
You still talk to her?
I haven't since I've been here in Dallas, but when I was still in Tyler and in San Antonio, yes, I did talk with her. And actually, I talked with a lot of my people from LSU. I tell them they're my family. They're the people that raised me in this business.
They're awfully proud.
Yes, they are.
Good.
And so I do try to keep in contact with them, and they know what's going on here. And you're right, they are very, very proud.
So you have that feeling. So if somebody gave you a chance, and then in your career, you've given many people a chance. That's a pretty good feeling, right? To be able to pay it back.
Yeah, absolutely.
Give someone an opportunity.
Yeah, I've had a person, he's no longer with the company, but he started out when I was in San Antonio, he started out as a PRN. I'll never forget this. We were at that facility, and I was visiting, I was rounding over there. And he comes in, he's like, I have my resume. I just, can I get an interview? And I said, okay. So he came in a nice suit and everything. So I said, sure. So we go through the interview, and I really didn't have anything for him. He's actually very overqualified. But I said, all I have is a PRN position. And sure enough, he ended up taking it, thankfully. And he went from a PRN as a registrar to a lead worker in our centralized scheduling unit. And he stayed there for a good little 3 to 4 months. And then a supervisor position finally opened up. And so he interviewed for that, and he ended up getting that role. And then he ended up being the manager for that facility, and then ended up being a manager at another facility under that region. So he's probably my favorite story of come up, but just that tenacity to stay in. And again, I think he has a chance to do it. So
that's fantastic. I had a guy, we hired a guy as a field rep, right? 25 years ago in San Antonio, I might add. And the guy just was he had the gift of gab and was really good at what we do. But so we hired him, and then I was talking to some of our people, and they were like, I don't know, let me talk to Isaac, and then I'll get back to you and whatever. And I was like, who is Isaac? Well, and it was the field rep that we had hired that had taken it upon himself. He just worked himself into a leadership role before anybody knew it. and ended up having a great career in this business, then went on to the insurance business. But I'll always love his story, right? He got a chance and we gave him a chance and he made the most of it.
Yeah.
So, well, that's awesome. I love hearing that.
Yeah.
So we talked about the big, beautiful bill. The last thing I have is in my questions is AI. Your thoughts, anything, any initiatives you guys have going? What are you doing? What are you not doing? What are you feeling?
AI, that is a interesting topic. So I have different feels for it. I think it's needed if you do it correctly. I think we got into this space, AI is the buzzword, and we said we have to have everything AI, and I don't think we really paid attention to what that actually means and what does it actually mean and what are we really accomplishing. So I like to say I take a little more thoughtful approach when it comes to utilizing AI. But you really have to know what is your end goal. What are you truly trying to accomplish? If you're able to, like for example, we're looking at transcribing orders. It is the worst thing that we have to do on a manual basis. And we get so many of them, particularly from our outside external providers. So so my end goal at the end of the day is I need that order into Epic as quickly as possible. Like that's the goal. And what I think happens when people talk about AI and what they're wanting to do with it is they take it in pieces. So, okay, we've got this order, it hit this repository, and now the next step is we're going to take it and we're going to get an index, put a date to it. And we just take it piece by piece when at the end of the day, the end goal is for it to be in the system. That's the goal. So how to make that happen versus these little pieces as they go. And I think we celebrate the little pieces, but at the end of the day, if you didn't put it in the system, you didn't do me any good. So again, kind of remembering what is the end goal you're trying to accomplish and how do we get there? And I think that's probably the biggest thing I think we miss about going down this path of AI is not knowing what we're really trying to get to, what we're really trying to accomplish. And we get distracted by all the other things that it can do versus what you're really needing it to do and how's it really going to be impactful. I've also seen places where they take their AI tool and it only goes so far and that's it. And I get it, but as the end user of that tool, it needs to make sense for us. And so there has to be that balance between our tech people and operations have to go hand in hand to make that happen. I get the win utilizing the tool, but if it didn't help my team, then it didn't really help me.
Yeah, it wasn't a win.
Yeah.
Well, Ryan, thank you so much. This was fun. I knew this would be fun. I knew this would be a good one.
Man, you're the best. That was quick.
It is. Well, we went through them pretty good. Unless you have some other questions or some other stuff that you want to go over, we certainly have time.
Yeah. What
is there something that you want to talk about?
I'm curious. What is y'all's goals for this year?
Rounding out, the projects that you guys have, right, is a big one. You guys are a major client for us, and so the conversion was, getting through those conversions. Is a big step and a big thing. And they've gone well. I know there's hiccups and whatever, but it's gone pretty well. So far. But that's that. Just we're always looking too. We're looking for new leaders, right? To help in different areas. Just the same, you flip the question around on me that I asked you. So we're always or promoting from within and looking for people, giving people opportunities, but we're also looking for new energy. So this the same thing, and so we'll continue to do that, I'm sure. And that's always fun. And a lot of times it's I know quite a few people in this business. I've been around for a long time, and so there's people that I've known in the industry that I now work with, right? And so that's fun. That's a good time.
You've seen everything twice by now.
A few, yeah. And again, and I still like it, so I keep doing it, right?
Yeah.
And so I'm having fun. But that's it, and the same thing that you had said. I just enjoy the people that I get to work with, the vendor partners. I have a few clients, right? And you guys are a major one. But when dealing with you, and I've said this, Steve Burr had this conversation that, you guys are my client, and then each one of your hospitals are our client as well, right? Each ministry is a client as well. So we're kind of in the middle of all of that, keeping corporate happy and keeping the hospital, CFOs and managers, directors happy and whatever. And so, it's not a one-trick pony with Chris or all. We have a lot of major health systems that we represent, and that's kind of the formula, making everybody happy, and each person in there is a client, not just the people in the corporate office, but the hospital level as well. So that's the trick.
One thing I would like to just throw out there, just as a good partner y'all have been, what I've told Melissa 1,000 times. So what makes y'all good is I don't have to manage y'all. Like we have that good enough relationship where something's going on, we feed that to each other. There is no, this is wrong, this is a problem, and everything's kind of, falling down. We just talk to each other and we're just like, okay, we'll figure out how to get the solution, we'll get there. But we don't have to, as the operations side of the house, we don't have to manage y'all, which is good.
The communication is unbelievable in this relationship. I mean, and then look, and we've got a good mousetrap and we have things, but the communication with your team, both corporate and at the hospital level, is awesome. And it's a testament to your people and ours. Yeah. That communication is vital. And we copy that. A lot of what we do with you, we copy with other systems. Because look, it's success. You can't argue with success, right?
It works.
It works. Stick with a winner. So we do. Thank you again. Thanks so much.